this Dumsor thing, it affects us all. We can all relate to this. When the lights are going off and on, we're worried about what effect it'll have on our appliances. More importantly, we're worried about the fact that we don't know in advance, and so we cannot plan. These things affect us on an individual level. Now just imagine the scale of that effect on big industries and institutions that rely so heavily on steady power supply. Well, we've got people representing two of such sectors and institutions here in the studio. Let's say good morning to Professor Dr. I love it when I have to say Professor Dr. Ernest Yorke, who is a consultant physician and endocrinologist at the University of Ghana Medical School as well as Kolebu Teaching Hospital. He also happens to be the Vice President of the Ghana Medical Association. Prof. Doc, good morning.
Thank you.
Now, it's our first time with Lucia Addae. She's the Executive Secretary of the Pharmaceutical Manufacturers Association of Ghana. That's PMAG, is that right? Lucia, it's very nice to meet you. Thank you so much for making the time.
Thank you too.
All right. Now, look, you represent two sectors of healthcare provision that are quite heavily reliant on steady and reliable power. We don't have that right now. In fact, we have Dumsor right now. And we are told that this Dumsor will not come with a timetable. Help us assess the impact of this on your activities. And if you don't mind, Lucia, I'd love to start with you. The Pharmaceutical Manufacturers Association. What does this do to you?
Okay, thank you so much. And good morning to your listeners. I think it's important to note that when it comes to electricity, it's fundamental to our operations. We have machinery that we need to keep on for a certain period of time, sometimes 72 hours. It has to keep running. And these machines provide life-saving medications, which are very important. So at the end of every treatment, you are given a prescription. It's a prescription that's going to actually help you to be well. And these medicines need to be manufactured. When we receive raw material, we need light to validate the color, how the raw material is, to also do some research on it to ascertain that it's actually what it's supposed to be. Then we would move it into a staging period, and then we'll do production. And then after that, we'll package it. And all of these processes, you would need electricity. So when you cannot predict when there is steady light, it really becomes a problem. And that means that you must have your generator on being automatic to ensure that you don't have that disruption. Because at the end of the day, business has to be done. People need their medicines. You need to save lives. You can't give an excuse of the fact that you didn't have electricity, being the fact that you can't manufacture medicines. If people need medications anywhere in Ghana or beyond, you need to supply them their medicines.
It just occurs to me that, well, I don't know, maybe your generators are different from the ones we use in our homes, but my generator at some point will need refueling. So I can't imagine that you have generators that can run continuously for 72 hours without refueling, do you?
No, we don't have that. So what we're actually looking at is we are looking at like different sources or alternatives when it comes to, power supply, because generators are also very expensive to maintain. You need some kind of fuel. It's very expensive. So you want to look at solar. But solar, again, is also expensive when it comes to the panels, it comes to the batteries. You could think of, let's say, other forms, which we don't really do here. If it's wind or biogas or anything of that, so we don't really do a lot of that here. But I think that there should be incentives for more people to actually invest in that kind of alternative source of power, because you can't keep a generator on for even 8 hours. Sometimes I would say the pollution, the cost of running it and all of that is just not sustainable.
So you've explained what the power is needed for.
Yes.
Can you give us some examples of actual losses that you incur because of the intermittent? I mean, like what things do you lose? What things get destroyed?
I can't quantify, because to start off, if we don't have medication, sometimes it means that people can die. So I can't quantify what production of medicines. I mean, you have millions of dollars in machinery that could go bad, and you have to fix them and all of that. I mean, that's just monetary. But when people don't have access to medicines, there are people that are going to be sick for a longer period of time, people that won't get their medication that could cause anxiety. When people are sick for a longer time, they need more support from family, they lose time on work and all of that. And I mean, ultimately, they could die. So I can't quantify a person's life.
I'm even asking about physical things in the manufacturing process. Like, do you, for example, lose entire batches of medication?
Yes, you could. If you are going through mixing, or if you are formulating and the light goes off and then you don't get it coming back on because you need a certain uniformity, a certain consistency, that batch could go bad. Your machinery could also go bad if you don't have steady electricity, because it's not just about the supply, you need it at a certain quality and all of that. And so if you are not getting that, then your machines could also have problems.
Wow. Have you had to, have some of your members had to perhaps lay off workers because there's no reliable power to?
So because of how specialized the people who work in our industries are, we try all the time to try and like maintain them on board, but sometimes it is a challenge, because if you haven't budgeted for having to pay extra, let's say for solar or generator or anything of that sort, then it becomes a challenge on the CEO to find money to ensure that there is steady electricity. So it's a tough call, I would say. Sometimes you may be tempted that you want to lay the people off, but because of the kind of investment when it comes to capacity building, training, you don't want to lay them off and then need them later.
Yeah, I get you. Prof, your members, I mean, they've acquired these skills with which they're meant to preserve and save our lives. But if the tools that they require to do that job are not available or cannot be used because there's a lack of power, you guys must sometimes feel quite helpless and useless in the face of emergencies when there's no lights.
I think it's even more than feeling helpless or useless, but sometimes it agonizes us, when such situations occur. And let me underscore, one point, that those of us in the health space, especially doctors, we are frontline. So what we do is to preserve health and ultimately, prolong life of people, and sometimes prevent death as well, unnecessary death. And what is happening now is really having a toll on what we do. Many facilities are complaining, many doctors, many practitioners. And let me just take you through a little journey of how this impacts on the work that we do. So you start with patient consultation. And generally now in most institutions in Ghana, it's electronic, especially those in the government space. So if electricity is off, the servers are down, we have to wait agonizingly. Patients waiting so long, and there's murmuring. They think that you are not up to what you up to the task. And then beyond that, if patient is admitted to the ward, you can imagine what will happen with that electricity, the monitors. How do you monitor these vitals? Because there could be a change in their situation within a second, and that or then if you're not aware, that remedy that you ought to have put in to prevent death, may not have happened. And beyond that, you can even talk about theaters. And on your promo, I heard you talking to Dr. Sefoga, and he alluded to the fact that he has surgeries to do, and sometimes surgeries have to postpone. You have to use torchlight. It is a reality. So you can imagine, so the consequences are far, reaching, and on what we do, especially preserving health and preventing death. Now you can even imagine going to the end of this value chain, and that is the last stop, which is the mortuary. Without electricity, what happens? So what we're asking for is some form of certainty that we can predict and plan as managers of institutions, as practitioners, and as providers of health. And the conversation must change as to whose Dumsor is the worst, whose Dumsor is the best. But what we need is reliable, stable, and predictable power, so that the health of this nation is not put into jeopardy.
We're going to spend a bit more time a bit later on the show talking about what we need. And make our demands quite clear, because this is a matter of life and death.
It is.
But I want us to get as clear a picture of the size of the problem as possible before we take a break, and then we come back and get into the solutions. And you've really painted a very interesting picture there about the entire value chain, and how electricity is needed at all points. Now, the added pressure for you doctors is that you are frontline. At the very least, Lucia and her colleagues, they are suffering, they are sweating in the factory. You are sweating in front of the patient. And we have seen some of the effects of this. There are videos going around, patients claiming their babies have died, and all kinds of people claiming their parents have died because life support wasn't available, and all of this. The pressure on you from patients who are the ultimate, I was going to say beneficiary, the ultimate victims of what's going on, the pressure must be huge.
It is, and some of us are losing sleep because, as leaders of a body like doctors, we get, keep getting calls on a daily basis. Sometimes they'll call you in the night asking you, what should we do? GMA, speak up. And they say, yes, we're trying, we're engaging, but ultimately the power is not ours. What we do is advocate, like we're doing today, and calling for the system to be stabilized. And the patient, as we said, are the ultimate, sufferers in this unfortunate situation. And we've had patients coming to us and threatening us, actually, that we need this. My patient, my relative ought to go for surgery, and he's not going for surgery. What is happening? And diseases, as you delay, becomes worse. Yeah. And then the patient will have to suffer some more complications. They have to spend more money treating the complication, more money because the hospitalization has prolonged. Who is paying for it? So the entire value chain, i.e. the providers and the patients who are at the back end, everybody is under pressure. And it's an unfortunate situation.
I come back to Lucia, there's an aspect of this that I do have to bring up. Dumsor is not new. Or in fact, let me say it this way. Our power supply in Ghana has never been 100% reliable. At one point or the other, there will be some fault or something that causes the lights to go off anyway. Before this recent, rather intense spate of power outages.
You mean the localized Dumsor?
Well, what they like to call it localized. Me, I'm saying that the lights go off in Ghana.
Okay.
It happens. I would have assumed that hospitals would have in place safeguards because this thing happens anyway, because it's a part of our lives. You would have some safeguards in place so that when Dumsor, no matter how serious Dumsor gets, it should not affect your ability to save lives.
Yeah, and I might say that most institutions in this country, because they know that we've had power challenges in the past, have some form of contingencies to deal with it. And the obvious one is the acquisition and operation of gensets. But the price of fuel now, and nobody can deny that. And so it's a toll on the finances of this institution. So in the past, it was the exception to use a genset as a stopgap measure as you're describing, but now it's becoming the norm, which cannot and is not sustainable. Because the tariffs, what patients pay for the services they receive is fixed. It's fixed by a body that the hospitals have no control over. The cost of generation is going, fuel is going up, and that puts a strain on their finances. But at this stage, what I would ask the managers, or tell them is that in the midst of adversity or challenges, when leaders emerge, so they should try and think outside the box and see what things they can do differently. Lucy mentioned about the use of solar, alternate power.
Or even wind.
Or wind. Well, wind hospitals probably not, but solar, yes. So we should look at the short to medium term, acquiring some of these alternate sources of power. And let's also be efficient at the workplace. Sometimes you go, fans are blaring, lights are on, nobody's there. So let's conserve energy whilst we still engage the providers, the regulators to be able to fix this problem. And we are calling on the electricity company of Ghana, Grico, and all who fix the tariffs to treat healthcare as an essential service, a critical service that ought not to be added to the general pool. Because if you did that, our lives, your life, and everybody's lives is at stake. You cannot put us on prepaid and then be harassing us, put lights off in the middle of surgery, and expect that we'll have come clapping for you. Yes, we understand that we must pay for it, but there should be some arrangements that does not ensure that powers are off when critically the power is needed to save lives. So that approach by UCG should change, and there have to be there must be engagement at all levels, including the Ministry of Finance, and the associations, not just doctors but the nurses, pharmacists, and everybody, so that we can jojo and see how best we can continue to preserve and save lives in this country.
Right. If you just joined us, we're talking to Professor Dr. Ernest Yorke. He is the Vice President of the Ghana Medical Association. He's also a consultant physician and endocrinologist, both at University of Ghana Medical School and at Kolebu Teaching Hospital. Lucia Addae is here with us as well. She's the Executive Secretary of the Pharmaceutical Manufacturers Association of Ghana, PMAG, if you want to use their street name. So we're trying to figure out, a way through this whole Dumsor thing. And first, we're trying to assess the effect of it on the work of the Ghana Medical Association and indeed pharmaceutical manufacturers. Now, Lucia, before we take a break, let me ask you this. Has your association approached, say, the Energy Ministry or even ECG or Gridco, with your concerns? Have you spoken to someone about this, and what have you been told?
Okay, so our mother ministry is the Ministry of Health. So usually when we have challenges, we will speak to Ministry of Health. We also coordinate or work with the Ministry of Trade. So they understand what we are going through, and then they would actually speak to the other ministries as and when required. We understand that, things are being done in the pipeline. So there will be some support. So we are looking forward to it. But currently, it is not what we want. So we are also encouraging members or CEOs to actually get the solar or alternative power. Because if we don't get some parts of the work of the grid, or we don't get some form of support, it would affect us. The machines are expensive. We can't keep replacing them or fixing them. We need the products, so we need to find a way around it.
Forgive me, I want to pin this down. Are you saying that you have formally informed your mother ministry, the Ministry of Health, and the Ministry of Trade that you work with? You've informed them of this situation, and their response to you is that support is coming?
Yes, so to the Ministry of Trade, there's been some engagement, some discussions on the availability, the quality, and also, I'll say, the affordability, because the rates are a bit high compared to, let's say, India that we compete with, or, all the other countries around us. So there's been engagement, it's ongoing. Like you said, power has never been stable. So it's a conversation. We've drafted policies, we've had conversations, meetings, and all of that. So, we hear the support is coming and we're looking forward to it, but as of now, it hasn't been done.
What specific support has been promised?
So specific promise on incentives for us to get alternative power,
right?
To get us constant electricity, treat the I would say the sector with a little bit of preference sort of, and then also to look at the rates and see what will be competitive, because today, if you, let's say, bring in some medications, I'll use infusion, the drips as an example, you would realize that if somebody brings it from India or China, comes to pay duty, carries it through the cargo and everything, sometimes they are relatively more affordable than people who make it locally. And it is also because the power is not stable, so you have to rely on other sources of power, because the electricity here is more expensive, the water is expensive relative to the countries around us and also to India or China. And so we need to look at how we can be competitive, because with Africa Continental Free Trade Area or with globalization, you are competing with countries that are putting in structures and measures or systems to ensure that they are competitive. And so if you go to bid in a certain country, your excuse cannot be that in my country is expensive. You have to find a way of ensuring that your price is competitive. So
this sounds like a conversation that's been going on for some time now. But since things got decidedly worse with this recent Dumsor. Have there been any specific communications, asking for some expedition of this promise of support?
So when it comes to like our sector, because a little sensitive, you have to keep engaging, and then you get platforms like this where you do some advocacy, but the engagements can go on for years until something maybe a little is done about it. But you can't stop engaging because there's nothing else you can do. So you have to keep engaging and then looking at what you can also do about the situation. So yes, it's been going on for years. Some of my CEOs are tired, they keep complaining, but that's the only way forward. We need to keep engaging, and then we are sure that maybe in future something will happen.
Well, what about you, Prof? Who have you spoken to and what have they said?
Well, through our mother ministry, I am aware that the association was part of a consultative process last year to engage the providers and also Ministry of Finance to try and see how they can deal with their legacy debts. And following from those meetings, the ministry issued a statement directing what health facilities and heads of agencies should handle it. In fact, there was an agreed mechanism between the Ministry of Health, GRA, and Ministry of Finance to deal and ring-fence the legacy debt. So, going forward, the facilities were not required to pay their own, let's just see, a cost that they incur.
Yeah.
But I must say that it has been a challenge. That notice was issued in the middle of the year, and so they had made budgetary provisions. And tariffs have remained the same. There's a strain of resources. There's increased cost of consumables. So, aside fuel and power, the cost that has gone up, other operational costs have also increased. So it's really putting the facilities in a fix, and we are struggling. And so what we're saying now is, again, let's come back to the table and see how we can resolve this unfortunate situation that the health facilities are going through. And ultimately, as you are aware, life is at stake here.
Yeah. Professor Dr. Ernest Yorke and Lucia Addae are our guests, and they're telling us how Dumsor is affecting their operations as the Ghana Medical Association and the Pharmaceutical Manufacturers Association of Ghana. Now, an important point was made earlier, I think, by Lucia, that, look, the purpose of such conversations is to advocate for things to get done. So let's do that bit. Let's start. Let's tell those in charge exactly what you need done so that you can continue saving lives. Lucia.
Thank you. So I think the advocacy is very simple. Businesses need electricity to function. It has to be stable. It has to be of the best quality. It has to be affordable. Whether you call it Dumsor, you call it whatever you want to call it, we need regular supply of electricity. There is medications that has to be made. Patients need them. You don't know what will happen to you. You could be in an accident or not feeling well in a certain village somewhere, and you need medication. Maybe you work at ECG, and then if you don't have that medication, something could happen to you. So it's important to think about that old woman in that village somewhere, that cousin who is not in Accra, who can just buy it on the open market. It's important to ensure that sectors that are critical, like health, like the pharmaceutical manufacturers, have constant access to electricity. We need to be able to, if it is sit down, if it is look at a roadmap, if it is however possible, ensure that there's constant electricity. Basically, that's what we are saying. Thank you.
There are some who say that the thing has already gone. So at this point, they can't give you stable electricity. In lieu of that, would a timetable help?
A timetable would help. It will help us to be able to plan, to look at what else we can do. Like I said, you can't use the generator for several days. And so if you know that you're going to be off for several days, then you have to look at solar. Is it possible to use solar without battery during the day? During the night, you could use maybe a generator or some other source, some other alternative. You could start discussing it and look at what the impact is financially. Look at whether you need some expertise, some human resource to ensure that there's efficient efficiency. Look at what else you can do to actually have those kind of smooth, I would say, transitions from one source of power to another, and whether you need to automate it and all of that. A timetable would definitely help, and I think it's important that it's communicated. I mean, if we are feeling it and asking for it, it shouldn't be a secret. Everybody should know that this is what is happening, and it should be a conversation of what can we do to make this better, basically. Thank you.
All right. Well, yeah, your energy minister says that if you want a timetable, make one yourself. Prof.
Well, I will first of all speak to my own colleagues who are managers of these health institutions, that they should make provision of power to run their operations a priority in these circumstances. So let's make sure that our gen sets, one will have one, or they're also in good working conditions. But it doesn't look like the situation is going to be over soon. And hoping that one day the schedule of power becomes stable. And also try and conserve power, at the workplace. Let's not the fan blare when it's not needed. The lights man go off when it is not needed. And also prioritize resources. It's scarce in the midst of what looks like many, but it isn't. And we can via certain budgetary allocations to make sure that we keep the power on to serve our clients, and in this case the patients. All of us are collective or collective patients, because I can be sick tomorrow and you can be sick today, and so we should be able to do things that will advance the health of all of us. The other group that I would implore on is the provider, i.e. the electricity and gridco, and to treat the health sector as a priority sector and not just any ordinary institution or sector. I mean,
if you don't mind, that's an important point. I always wanted to ask about this. So how would that work? I mean, these hospitals are in communities.
Sure.
When the lights are put off, they are put off in communities as per the grid. So I mean, is it even feasible for, say, gridco to communicate only with hospitals and tell only the hospitals when the lights are going to go off? If they don't want to tell the whole world, can they prioritize only the hospitals? I mean, would that information be secure? Would you not call your wife at home and tell her that you see your bedroom light?
No, what I am told, that they have these points, supply points on their dashboard,
right?
And so they can isolate certain vital institutions. I'm not sure Dumsor occur in, say, the military bases and the flag servers, because they've been isolated. Yeah. And I'm aware that in the past, for instance, when there was thick Dumsor, we see some reprieve, and so it's something that can be done and should be encouraged. Yeah. And let's not pretend as if it's not. It is very possible. So let's treat health as a vital service. And it's because of health, the lives of people are at stake here. It cannot be treated as a shop. I mean, with all due respect, a shop can sell tomorrow, but life lost today is irredeemable. And so things must change. And the tariffs that the hospitals charge as well, Mr. Minister of Finance, and those are responsible. Let's look at, enhancing it so that a lot more resources come to the table for the health facilities, to use in these trying circumstances. And again, I think that it's high time we revisit the consultative process with all the stakeholders, the providers, the regulator, the ministry, the doctors and the other health, providers, to see how we can together come up with a way that would preserve life ultimately, and to reduce this off and on, thing that is going on. And finally, Kojo, I'll add my voice that we need a timetable. We need to plan, because surgeries cannot be stopped in the middle of it. I mean, you cannot stop somebody who is in a life a support machine, for instance. So if you know that I need to, I'm going to go off 3 hours, I'm going to make sure that the genset is working within 3 hours. I'm going to have fuel available to be able to preserve life, and I underscore preserve life. So let's do things differently, and please treat health as a priority sector, Mr. Mr. ECG, if you can call him that way. So I'm calling on the leadership, of these value chain providers to make sure that things are done differently going
I'd
forward.
probably want to draw the attention of the energy minister, since he superintends of all the institutions that would have to work to create that priority for the health sector. Here's how I want us to wrap things up. I think we have 2 minutes left, so I'll split 1 minute between 1 minute each between the two of you. Give us a picture of what will happen if nothing changes, right? If this continues, at the end of this, what give us that worst case scenario of what will happen to your specific sectors if nothing changes.
If nothing changes, it could be dire. I mean, the honest truth is that if there's a lot of pressure on the companies, we'll have to let people go home. We have to cut down on production. We'll have to find alternative ways of making power available. But if the cost is too much, companies would have to close. And we don't want that. We want to be able to increase the number of pharmaceutical manufacturing companies we have. And so we don't want that very gloomy situation. Everybody's trying to stay afloat. Everybody's trying to do their best. And so we don't want a very dark picture. But it could be that if we are not able to tell what needs to happen and, what's going to happen next.
Which will mean that medications will become more expensive.
Yes.
More people will be priced out of
Yes.
the ability to even stay alive.
Yes.
Yeah, I can see how bad that could turn out. Prof.
Yeah, I mean, we're hoping that things will change, but if it doesn't, the way we're going, certainly there will be more queues at the outpatient department because the electronic management systems will be down. There may be fatalities or worsening of patients when we admit them. Surgeries, we know the obvious consequences if lights go off while doing surgery. Even at the morgue, bodies can decompose, diseases may outbreaks may occur. Even the children may suffer in the intensive care, the unborn babies, the born babies. And again, linked to the children is vaccines, because you need a cold chain to preserve the potency. So if they lose that cold chain, they lose its potency. You cannot vouch for its potency to be able to prevent the disease that they want to preserve. But could you lastly, before I sign off, there's a saying in Akan which says, Adama, me mamia wonaka se me beni. What I need is that this is my mother's son or daughter, and so he's my sibling or brother or sister. That's all I need. I don't care how, no matter how the baby came. So all we need, as those of us in the health space, is stable and reliable power. It doesn't matter whose Dumsor is worse or is better. We need stable power, reliable power, and a timetable to plan and ultimately to save lives and the people of this country.
Professor Dr. Ernest Yorke of the Ghana Medical Association, Lucia Addae of the Pharmaceutical Manufacturers Association of Ghana. I want to thank you both so much for your time with us this morning. Really appreciate it.
My pleasure.